Hello, welcome to Med Math Mondays. We're going to start off today with tablets. Very simple, but we're going to work our way up gradually, right? This is Nurse with Nurse A. Please like, subscribe. The healthcare provider, HCP, orders acetaminophen Tylenol 650 milligrams, needed for pain level less than 5 out of 10. Available, the Tylenol is 325 milligrams. How many tablets will the nurse administer? The very first thing that you need to ask yourself is, what is this question even asking me? Well, it's asking for tablets, all right? So we're going to write right here, tablets. And you can write it tabs, tablets, it's the same thing. But I'm going to box it. The reason why I'm going to box it is because I want you to know at the very, very end of this problem, I need to be left back with just tablets, all right? So because I have tabs, that's what we're looking for, we have to start off with tabs, all right? We have to identify what one tablet is first before we can identify 20 tablets, right? So one tablet is available, Tylenol 325 milligrams, all right? That's what we have available. That is what pharmacy is going to supply us with, all right? So one tablet is equal to 325 milligrams. Whatever unit you have down here, you're going to have that same unit on the top. So I'm just going to go ahead and write that unit first. And then let's go back to our problem. But the doctor ordered 650 milligrams. So we're going to write 650. At the very end, you have to cancel out. And this is using dimensional analysis. So we're going to cross out milligrams, and we're left with tablets. And that is exactly how we know that it is now time to solve our problem. So you only can cross out diagonally, all right? So now we're going to multiply 1 times, because this dot right here is multiply, 650 is going to be 650. And then 325 times nothing is just going to be 325, all right? And some people may add a 1 here just to like give it a friend. But the only thing you can't do is you can't put a 0, all right? So you can just only leave it as blank or a 1. So now we're going to say 650 divided by 325. You put it in your calculators and whatever your calculators tell you, all right? And that is going to be 2 tabs. So this person would receive 2 tablets based off of that doctor's order. All right, and we're on to problem number 2. The patient is ordered 0.5 milligrams of digoxin. 250 microgram tablets are available. How many tablets will you give? All right. Before we start this problem, the first thing I need you to do, and every time you get your exams, I need you to go ahead and write down your conversions. So if that takes you practicing it every day, just writing these conversions down, they're going to come in handy when it's time for the exam. So the first one is going to be 1 kilogram equals 1,000 grams. All right. 1 gram equals 1,000 milligrams. And then 1 milligram equals 1,000 micrograms. All right. So we're always going to write down our conversions first thing as soon as we get our paper. So the next thing we're going to do is, what is this question asking us for, right? We always need to determine what is it asking. It's asking us for how many tablets. So let's go ahead and write tablets here. All right. So we write tabs. And I usually put a little box just because at the end, I need to ensure that I'm left with just tablets. And so because we wrote tablets here, tablets have to go on top. All right. We have to determine how much 1 tablet is first before we can determine whatever the doctor ordered. So 1 tablet is equal to what we have available. All right. 250 micrograms. All right. So because we have micrograms down here, we have to have micrograms on the top. Correct. All right. So let's go back to our problem. Let's see if we have any micrograms. We have 0.5 milligrams. Oh, so that should make us click. Something should click to let us know that, hey, we have some form of conversion that we have to do. So based out of these conversions, which one do you think I have to choose? If anybody said this one, you are correct. You are going to choose the one with micrograms because that is what has to go on top. Now we're going to pull, this says 1,000 micrograms. You need to put 1,000 micrograms. We're going to write exactly what we see. 1,000 micrograms equal 1 milligram. So then we're going to write 1 milligram. So put exactly what you see there. Because we have milligrams on the bottom, we have to have milligrams on top. Correct. Now let's go back to our problem to see if we see any milligrams. The patient is ordered 0.5 of milligrams. Okay, great. So we're going to put 0.5 milligrams, right? You can give it a sister, you can give it a friend, but you can never put 0 there. So you can just put a little 1, all right? Now let's do some crossing out, elimination, see what we're left back with. Cross out micrograms, cross out micrograms. Cross out milligrams, cross out milligrams. And we're left with tablets, and that lets me know, cha-ching ching, it is time to solve my problem, right? So we're going to multiply 1 times 1,000 times 0.5. All right, so let's go 1 times 1,000 times 0.5 divided by 250 times 1 times 1. And what does that equal to? Correct. That's going to be 500 over 250, which equals to, correct, 2 tabs. So sometimes you're going to get problems where you have to convert. But if you don't know when you need to convert, in this case, micrograms was at the bottom, but we didn't have any micrograms in our problem. So that's going to automatically let us know that we have to use our conversions right here. All right. And we're going to learn way more conversions as we continue on. So if you like this video, please like, subscribe, and comment.